All right, everyone. It is a little bit after 3. I did want to give some time for more of our folks to join before we begin. So I'll go ahead and start so we don't cut too far into time. But nonetheless, we'll go ahead and get started. Everyone, welcome, and thank you all so much for joining us for today's webinar, for our highly anticipated webinar on human trafficking prevention, research tools, and best practices for identifying and supporting victims. My name is William Moore, and I'm with the Office of Juvenile Justice and Delinquency Prevention's National Training and Technical Assistance Center. Today's webinar is brought to you by the Office of Juvenile Justice and Delinquency Prevention, also known as OJJDP, in conjunction with the OJJDP's National Training and Technical Assistance Center, the Office of Victims of Crime, the National Court-Appointed Special Advocates, the National Human Trafficking and Technical Assistance Center, and Youth Collaboratory. Again, my name is William Moore. I'm with OJJDP's National Training and Technical Assistance Center, and as your technical host, I would like to take a couple of minutes to discuss a few features of the Adobe Connect webinar platform and provide a few announcements to keep in mind. Please note that today's webinar is being recorded. The webinar will be posted on INTAC's YouTube page, where you can view other archived webinars. For transcript and support materials, please contact the OJJDP TTA Help Desk. For those wishing to download a copy of the PowerPoint, slides, and other important documents, you may do so by locating the Handouts pod directly above the chat area. Here, you will also find an FAQ for webinar participants that will likely address any technical related questions. Please note that we will also have a location where you will be able to select any of the links for resources that our presenters have provided. You can simply click on the name of the link and it will take you directly to the website there. And this is located right below the Handouts pod. It is in the pod labeled Human Trafficking Prevention Webinar Links. At the end of today's webinar, there will be a Q&A session where the presenters will address some of the questions posed during the presentation. Please type your questions into the chat box as they arise. Please note that this next part is only for people who are viewing today's webinar in a group. For those of you participating in today's webinar as a group, please take a minute to help us count. Go to the chat window and type in the total number of additional people in the room with you today. If you're viewing alone, there's no need to type anything at this time. And again, please type in the total number of additional people in the room with you today. If you're viewing alone, there's no need to type anything at this time. Following today's webinar, attendees will be sent a certificate of attendance. This certificate is sent approximately 1 hour following the conclusion of the event and is sent via an Adobe Connect thank you email. Please keep an eye on your email for your certificate. Also note that only individuals who are virtually signed into today's webinar will receive a certificate. And finally, at the conclusion of today's webinar, you will be provided with a link to a brief survey about today's presentation. The feedback you provide is used to assist in future planning and training. I will now turn today's presentation over to our moderator, Ms. Cynthia Pappas, for today's webinar. Thank you.
Thank you, William, and thank you all for joining us today. As we're watching those numbers climb, we're already over 600 participants, so it shows really how important this topic is, and we truly appreciate you taking your time out of your very, very busy days. So thank you all for joining us today. Again, today's discussion is on human trafficking prevention research, tools, and best practices for identifying and supporting victims. Again, my name is Cynthia Pappas, and I'm a Senior Policy Advisor with the U.S. Department of Justice, Office of Juvenile Justice and Delinquency Prevention, also known as OJJDP. And today I have the distinct honor to introduce our panel of experts. But first, I'd like to set the stage for today's conversation. I'm going to jump into the objectives. The goal of our webinar is to provide you with current research, tools, and best practices for identifying and supporting victims of human trafficking. It's our hope that by the end of today's discussion that you will have a greater understanding of federal efforts, data, research, and resources to address this issue within your communities, and that you'll have a greater knowledge of the indicators for children and youth at risk for becoming victims of human trafficking, as well as appropriate responses to suspected human trafficking and prevention strategies. And finally, we will provide an opportunity to discuss the application of research and survivor-informed best practices. But first, let's get a sense of who is in our audience. I'd like to start with a poll question. You didn't know you're going to be quizzed today. Sorry about that. William, can we get the first poll? Excellent. That is pretty tiny. I'm glad I have my readers on. How would you rate your current knowledge on the topic of human trafficking? So are you not at all familiar, slightly familiar, somewhat familiar, right there in the middle, moderately familiar, or extremely familiar? So if you can take your mouse and click in the circle beside the one that most accurately addresses how familiar you are with the topic of human trafficking. Which again, we know it is pretty broad, and we'll be covering in what that all means. But how would you describe yourself? Not at all familiar, slightly, somewhat, moderately, or extremely? And those marked extremely, we're going to be coming after you for our next webinar. Give everyone here just probably 10, 15 more seconds. Responses are still coming in. Looking like somewhat familiar and moderately familiar are the majority. I see some people also in the chat putting it extremely and letting us know via the chat room as well. So thank you for that. William, I think that we have a pretty good sense. I think we can give it maybe a second and we are good to go. So most are moderately to somewhat with a few extremely. So thank you for taking that time. That's really helpful to give us a sense of where we are, and then hopefully after we can see how much the knowledge has increased. Okay. We did that. So to get us started, I'm going to provide just a really broad overview of this topic with a brief discussion of the definition, the prevalence, and the Department of Justice's approach to assessing and addressing human trafficking. Again, this could be a full-day webinar, and I really do want to turn it over to our panel of experts, but I think this will help set the stage and help us get into the topic with kind of the broader overview first. So the Trafficking Victims Protection Act of 2000 and its subsequent reauthorizations define human trafficking as within these two areas. Sex trafficking, in which a commercial sexual act is induced by force, fraud, or coercion, or in which the person induced to perform such act has not attained 18 years of age. I'm going to break that down in a second. Or secondly, the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through the use of force, fraud, or coercion for the purpose of subjection to involuntary servitude, peonage, debt bondage, or slavery. So sex trafficking is one form of commercial sexual exploitation. Commercial sexual exploitation can refer to a range of crimes and activities involving the sexual abuse or exploitation of a child for the financial benefit of any person or, and this is really important, in exchange for anything of value. So that does not necessarily have to be in exchange of money or monetary goods. It can be in exchange for food, for clothing, for shelter, for drugs, or for protection. It does not have to be in exchange for money. And again, and these crimes include child sex trafficking. So commercial sexual exploitation includes the crime of child sex trafficking, which is the focus of our discussion today. And as we were talking about children and minors, this is the important part. Force, fraud, or coercion does not need to be present in a situation of trafficking of minors. That does not have to need to be proven. So that's our definition. How prevalent is it? We don't know the exact number of children in the United States who are sex trafficking victims and survivors. It's unknown. And those of you possibly working in this field are really aware of the hidden nature of this crime, the differences in definitions and methodologies and terminologies that jurisdictions and professionals use to describe child sex trafficking crimes as well as their victims. It is a very complex victimology and crime, and that's why we don't have the exact numbers, but we are working, and the National Human Trafficking Hotline, which is operated by Polaris, and you're going to hear much more about this fabulous resource throughout today's presentation. But they maintain one of the most extensive data sets on the issue of human trafficking in the United States. So what I have up here is just numbers from 2018. So the report that's on the website, on the National Human Trafficking Hotline website, indicates that there were 10,949 human trafficking cases reported to the hotline last year, to include 7,859 sex trafficking cases. Again, as we just talked about the definition, human trafficking can take a lot of forms, sex or labor, adult or child. So of these 859 sex trafficking cases, of those 2,378 cases were sex trafficking of minors. And again, I do need to reiterate, the data displayed on this site and what I have up here on the slide is generated from information that is communicated to the hotline via calls, text, online chats, emails, and their web form. It's not a comprehensive report on the scale or the scope, but within an area, but it does give us a sense of how prolific this problem truly is. And if you don't have it, I have the contact information. That is the contact to the National Center, or I'm sorry, the National Human Trafficking Hotline that you should have at the ready. And is where you can report cases as well as get this type of information on their annual reports. In bringing human traffickers to justice and assisting survivors of human trafficking are top priorities of the U.S. Department of Justice through investigations, prosecutions, services for victims, training, enforcement and outreach initiatives, and grant funding to state, local, and tribal authorities and to non-governmental organizations, which I'll get into our grant-making programs in a moment. But again, giving the broad brush from the White House on January 9th, 2019, President Trump signed the Trafficking Victims Protection Reauthorization Act and proclaimed January 2019 as National Slavery and Human Trafficking Prevention Month. The President's Interagency Task Force to monitor and combat trafficking in persons is working across the U.S. government, to include all of the agencies, to prosecute traffickers, protect victims, and prevent these crimes before they take place. As part of the task force, the Senior Policy Operating Group, also known as SPOGs, consists of senior officials designated as representatives of the task force. And we work year-round to address the many aspects of human trafficking, both in the United States and around the world. So for more information on the task force, the link is available, and I sent that to William. It should be available. I can actually possibly put this in the chat center now as well. So I just threw that into the chat room. So you have the link there to get more information about the task force. And then I've also included the most recent task force report in the document section, in the handout section of our webinar. And that last report was 2017. Also, the Attorney General's Trafficking in Persons report, submitted annually to Congress since 2004, describes the U.S. government's comprehensive campaign to combat human trafficking. This report provides information, again, on all U.S. governmental activities, and I've included that in the handout section as well. So if you're not familiar with these resources, they are there for you to download and take a look at to give you a general sense of what the government, from the broader White House to the U.S. Department of Justice, is doing to focus on this horrific situation and problem. And that boils down to what our office is doing. So the Office of Justice Programs, we are a component within the U.S. Department of Justice. And then within the Office of Justice Programs, there are other agencies and bureaus. So the Bureau of Justice Assistance, the National Institute of Justice, the Office of Juvenile Justice and Delinquency Prevention, and the Office for Victims of Crime. We have a tremendous amount of resources across my agency and across my sister agencies here listed on this slide. So I won't go through all of them. I do want to make sure that you have the links. I'm going to briefly do a broad stroke across each one, but again, you have the links here to look in as publications, the resources, and maybe most importantly, for many jurisdictions, is the funding that is available through our grant-making program. So again, all of that is available on these websites. So starting with BJA, they develop training for law enforcement and communities to identify trafficking in persons, and they fund task forces to investigate and prosecute all forms of human trafficking. Through the funding of rigorous research, NIJ is committed to assisting with the detection and prosecution of human traffickers. NIJ-funded research projects focus on the nature and extent of human trafficking, detecting and investigating traffickers, prosecuting traffickers, and services for trafficking victims. Again, NIJ is the research arm of the Department of Justice. OJJDP, which is my office, we fund the Specialized Services and Mentoring for Child and Youth Victims of Sex Trafficking Initiative. This is a grant-making initiative, which you're going to hear much more about from our Youth Catalyst team member in a moment. It's one of my favorite projects that I'm working on, and the intent, the purpose is to increase the availability of direct support services for children and youth who are victims of commercial sexual exploitation, to facilitate outreach efforts, and to develop organizations' capacities through mentoring for this vulnerable population. And last but certainly not least, our sister agency, OVC, since 2003, has supported the development and enhancement of programs designed to provide a comprehensive array of culturally competent services to victims of human trafficking, including the Faces of Human Trafficking video series, which is a fabulous resource to use within your agencies and within your communities, and the enhanced collaborative model to combat human trafficking developed in collaboration with BJA. Again, not going to dig in any more into these, but if these are resources and tools that you think might be of interest, go to those links, see what we're doing, and then and reach out as funding and other publications and resources become available through our site. So enough of me. Now while you're actually here, it is my sincere pleasure to introduce today's panel of experts. First, you'll hear from Aubrey Lloyd, who serves as the Human Trafficking Team Lead for the Office of Victims of Crime Training and Technical Assistance Center. Ms. Lloyd, a survivor of human trafficking and a survivor advocate, will provide an overview of human trafficking, protective, and resiliency factors. Next, you will hear from Dr. Debbie Staub, Senior Director of Training, Development, and Knowledge Management for the National Court-Appointed Special Advocates Guardians Ad Litem Association. A former special education teacher, Dr. Staub has been an advocate for children, youth, and families for the past 30 years. and she will lead us through a thoughtful discussion on identifying and engaging human trafficking victims. Then, Jenna Novak, Deputy Director at the National Human Trafficking Training and Technical Assistance Center, who holistically builds the capacity of communities vulnerable to trafficking by applying a public health approach to prevention and intervention efforts. Ms. Novak will provide you with vital human trafficking prevention strategies and resources to share within your network. And again, one of my favorite people, Nova Murari, Youth Catalyst team member with Youth Collaboratory. Youth Collaboratory is the training and technical assistance provider for our mentoring program that I just mentioned briefly. Nova will provide a powerful overview of the important work of Youth Collaboratory and the value of youth-informed, youth-led approaches and strategies for partnering with young people to develop solutions to this social problem. So with that, I will turn it over to Aubrey to begin today's panel discussion. Thank you.
Good afternoon, everyone. This is Aubrey Lloyd again with OVC TTAC. So thank you so much for being here, and I'm really excited to be part of today's conversation. So before we begin, Cynthia did the pleasure of going through all of the meanings of our long name, but wanted to talk to you a little bit about who is OVC TTAC so you can also have a sense of the resources that are available. So we are practitioner-driven, evidence-based training and technical assistance that is really responsive to the needs of multiple victimizations and their service providers, their communities, and all of the victims that are served. We have a specific focus on human trafficking. So what type of training and technical assistance could be included is really tailored. So we could have on-site consultations, such as defining and measuring best practices for human trafficking programs. Maybe you're wanting to understand a little bit more about complex trauma or how to incorporate survivor-informed practices. We also have professional development online, and some of those trainings include what is a trauma-informed organization. And trainings also really focus on building your capacity as an organization that leads everywhere from leadership to sustainability. And lastly, our Human Trafficking Task Force e-guide has a multitude of resources and promising approaches around really building and maintaining an effective trauma-informed, multidisciplinary response to human trafficking. And all of our support comes to you at no cost, and I would be happy to help you, any of you brainstorm on what your current needs are. And if you're interested in any of those resources that I just mentioned, we do have the links to the resources in the link section just above. So as you kind of get to know who we are, what I've been asked to talk about today is to really kind of help define risk factors and protective factors. And so that's the element of the conversation we'll have today. So as we think about what those things mean, I think it's really important to kind of broaden our aspect about identification and even just how we're looking at human trafficking and the multiple lenses that we have. If you're familiar with human trafficking, that many of you are in the poll, you probably have heard about red flags and other indicators, kind of like a checklist of sorts of how you would be able to identify a human trafficking victim. And although those are helpful, it can sometimes provide only a small perspective of who a victim really may be. So today we'll be looking at risk and protective factors that will provide a more comprehensive look, not only at identification, but really those important resiliency factors that you're going to be hearing from all of us today. So let's define a little further. I won't ask you a poll question, so you don't have to answer that, but what is a risk factor? So by definition, a risk factor is a characteristic or experience that increases the possibility that an individual will experience a violent crime. So it's not the cause of the crime, but it definitely increases the vulnerability of being a victim of one. The next one is about what is a protective factor, so kind of the reverse counterpart. So a protective factor is a characteristic or experience that decreases the likelihood that an individual will experience a violent crime. So instead of kind of thinking of everything as siloed of, risk and protective, I really joined the conversation today because I think it's helpful when we're thinking about how to identify and how to support. So the first piece to kind of think through is we do use the CDC's, the social ecological model. And again, this is just in a different way to kind of look at human trafficking through a broader lens. So we'll be talking about that today. So taking a look at individual factors, and hopefully you have an ability to blow up your screen and you'll have this available to you afterwards. But when you're looking at kind of what could be those vulnerability, those risk factors, so some examples from an individual level, so there could be age, obviously we're talking about minors today, lack of education, lack of connection to higher education, low income, substance use, disability, experience or witnessing physical, psychological abuse, and you'll hear from my counterparts today of just kind of how that really increases vulnerabilities for some of the youth that they are serving. And then kind of how are we looking at protecting risk factors or looking at that prevention piece is, are we providing educational stability? Are we allowing kids to have access to that, in or out of systems? Do they have access to steady income for their families? And then are we really looking at and addressing mental health supports? So kind of expanding that, that circle for us, looking at the relationship. One of the quotes that have stuck with me so much in relationship to working within this crime is that, trauma occurs at the hand of a relationship, and often what's needed to heal is the same context of relationship. And I've heard that reiteration a few different times. But relationships are so important of not only how we define what happened to us, but how we define how we're going to heal. So some different examples of relationship risk factors. What if they have, aggressive or violent peers? Bullying could definitely be a factor here and something that we're very mindful of right now with our youth. Maybe there's an isolation. Maybe there's a lack of support from the family. Maybe they have a lack of financial stability. So we see themes are really universal. And other protective factors, are we increasing peer support? Are we being thoughtful of how we're intervening for bullying? Are we helping to support the whole family with their mental health pieces? So again, what we can see as we kind of continue to, build through the different lenses is the importance and definitely themes that are going to be cross-connecting. So again, we're looking at a community factor, and this is kind of where we are right now. We're all, as a community coming in wanting to learn more and lean into this topic today. So as a community, risk factors, poverty, lack of resources to build social supports and healthy relationships, lack of intervention, especially around violence or intimate partner violence, maybe easy access to substances. And then as a community, how we can respond. Access to resources that address and reduce poverty, that really ensure the access to education, supportive services and resources for individuals, especially with disabilities. So again, looking at these multiple lenses of different ways that we can look at vulnerabilities and also how we can resist those. So the societal factor, this can really be a long, conversation as well. But just some different examples of what this piece looks like. Does our society allow discrimination? Do we have income inequity? Do our laws and policies maybe limit health care, limit access to education or mental health resources? So just really looking at the cultural norms that even condone violence. In different trainings and the different settings, they talk about, who is a trafficker in different ways that they may, lend themselves to wanting to exploit, and what part of our society is kind of allowing those conversations in that context to continue. So, not everything has an answer, but definitely worth asking the questions too. And as you're talking about your intervention strategies and the way you want to support this in your community, to be thoughtful of that reality. Another thing about social protective factors is, again, that education and awareness and policies and procedures and funding, just like Cynthia really broke out across the different bureaus and offices, the importance of allowing access to funding to be able to start addressing some of these items. So how can traffickers exploit those risk factors? So kind of using the same domains, I just want to kind of go through each of those a little bit real briefly as well. And thank you so much for asking questions as we're going along. We're going to have time as we, continue to go through and at the end. So thank you so much for engaging already. So from an individual perspective, things that we have seen, not just for me, but others that are on the phone as well, is that maybe a trafficker may coerce a victim into trafficking with the promise of a substance to prevent withdrawal symptoms. If anyone has worked with addiction, they understand the very negative and powerful impact of withdrawal and how often that is more severe than any other piece of the addiction. And we have seen, different cases prosecuted across the country that use that as a leverage to help traffic a person. The next piece, obviously, is going into relationship. And especially when you're working with youth, the promise of belonging is developmentally where most kids are. The desire to be seen and connected to their peers is incredibly powerful. And unfortunately, some traffickers have really become to understand how to exploit that. So maybe a trafficker may falsely promise love or security to coerce someone into human trafficking. So again, looking at the context of the community you're serving and looking at that piece from multiple lenses is incredibly important. And then as a community, kind of like as I said of us coming together today, a trafficker could use forced fraud or coercion against a person, maybe with a disability, in order to exploit them through sex or labor trafficking. And how the community kind of interplays here is if there's a lack of supportive and reliable and consistent resources, that can contribute to that vulnerability. So if a trafficker knows that this vulnerability exists and also knows that a community does not have access to help support those types of individuals, or there's not an easy avenue to understand that resource, that can definitely be a gap that is exploited. And the next piece we'll talk about is, again, looking at the different domain of looking at, from the societal lens. What we see a lot here could be the promise of economic stability. And although we're talking about minors today, there are minors across our country that unfortunately are put in a place where they feel or even told or even led to feel like they have to be responsible for supporting their family even at a young age. And so an economic stability or the promise of that when someone is struggling to find employment, and that could be due to discrimination, immigration status, or just again, like I said, youth being put into that unfortunate situation, a trafficker can use fraud or coercion to suggest that they could offer something, stable, they could, offer a higher source of income. So again, looking at those, multiple avenues and the different ways that we can see trafficking occur, it's not just a list of risk factors. It's not just the key, the red flags that could occur, but thinking really broad of all of the different ways that we intersect those vulnerabilities, I think is really powerful for today's conversation. So when we wanted to talk about building resiliency, it's powerful, again, to use the same kind of model. And when I was talking about protective factors, some of this kind of lends itself very naturally to the conversation. I just kind of wanted to give a couple key examples. And again, you'll hear this echoed through today's conversation. So when we're talking about individual factors, some really important pieces to think about is how can we build agency and self-care and promoting internal strengths and routines. That's kind of the mighty ant, right? And some of you that have worked with youth, these kids can be so mighty and so resilient. And so how can we really promote that and provide opportunities for that strength to be, encouraged and developed? When we're looking at the relationship side. So, how can we be consistent in our relationships and really care about the wholeness of the person, not defining our goals and objectives and what we feel is best for them, but really supporting that part. And I love the context of kind of, the picture with, the under the umbrella. Our piece is not to say, let's stop the rain. Our piece is to say, maybe we can offer something to stop you from getting wet. And so I think from a relationship standpoint, whether you're a service provider or a caseworker, I saw some folks on here that's involved in juvenile probation and parole, being that consistent piece of a relationship can transform in just you showing up and being consistent. So, just you being part of this can really be helpful. And on a community, we talked about the importance of collaboration and having a continuum of support for both services that are emergent and long-term. And from a societal perspective, again, equal access to health, education, economic opportunities, making sure we're talking about social policies. We're really, challenging cultural norms. So I gave you guys a lot of words and a lot of different things to think about as we start the conversation today. And I want to again highlight not only the resources and support that OVC TTAC has, but the other presenters. And OVC also has human trafficking specific providers focused on building legal responses, the importance of housing, employment and education, building trauma responsiveness, and informing the courts to better understand human trafficking. So again, please reach out as the most effective response is done through collaboration and partnership. And up next, please welcome Debbie, who will further discuss the importance of identifying and engaging with human trafficking victims. Thanks so much, everyone.
Good afternoon or morning, depending where you are from. I'm Debbie Staub, and I really appreciate the opportunity to be invited to present on this very important topic. I work for the National CASA, Guardian Ad Litem Association, as the Senior Director of Training Development and Knowledge Management. We lead the continued growth and development of an extensive national network of programs, local programs, and each which recruits, trains, and supports volunteers. In 2018, we had 950 local programs operating across 49 different states in the country. We had 93,300 dedicated volunteer advocates, and we served 271,800 children over the course of that year. I also wanted to say on a personal note that I am a volunteer myself. I have been a volunteer since 2009, and I have served several families, children and youth, that I know have been impacted by this very issue that we were speaking about today. It's often generational, and it's also very much a part of the risk factors that Aubrey spoke of earlier, seeing all of those things occurring for many of the children and families that I've worked with in my role as a volunteer as well. At National CASA, after completing a rigorous screening and pre-service training, volunteers are appointed by a judge to advocate for a child's best interest in court. Volunteers stay with each case until it is closed and the child is placed in a safe, permanent home. We do serve children from birth to age 18 or 21. In some states, children are allowed to remain in a foster home type of placement until age 21, and they will continue to receive services as appropriate. Volunteers work with legal and child welfare professionals, educators, and service providers to ensure that judges have all the information they need to make the best, well-informed decision for each child or youth. So CASA volunteers learn all they can about the child and their families, the relatives that are important to the child, the peers that are important to the child or youth. We engage with the child and the youth by having regular visits with them and regular visits with the other folks that are important to them. We make recommendations about their best interests in court regarding, very importantly, their child placement and needed services. And we monitor their situation until the case is released by the court. A very important part of the role that we have is collaborating with others to ensure that the necessary services are provided and are in the child's best interest. And then we report what we have learned and observed to the court based on all these different findings. It's really important for us to be providing training to these volunteers that help them have the eyes and ears, oftentimes that the court personnel doesn't have, or that the attorneys who may have multiple cases on their caseload aren't able to dedicate the most amount of time to. Even if they wish they certainly could. I know that that is the case for many of the cases I have worked on. So the volunteers are in a unique position to really get to see that child or youth across numerous environments and speak to many different people who have the best interests in mind for that particular child and youth, and understand from the lived experience of the youth what it is that they need best to support themselves. Obviously, based on the age of the children that we serve, that will vary according to their ability to communicate their wishes and desires to us. Sadly, there is quite an intersection between the child trafficking number of victims and the children that are involved in child welfare. The data, as you heard earlier from Aubrey, is not nearly as robust as we would like. And Cynthia also mentioned how hard it is to get a real good count on the number of children and youth that are impacted by child trafficking and victimized and exploited. And our child welfare systems aren't that fabulous, to be quite honest, at collecting this data as well. Some of the child welfare local agencies will have a very solid, structured ability to keep track of this data, and others, it's not even honestly on their radar to start tracking these numbers. I give a lot of credit to my colleagues on the phone today and those of you out there in the field that are helping change that. The data is really important for us to have at our disposal so that we can fight for stronger policies and better practice. And I noticed one of the questions that was asked by an audience member is the data being broken down into gender? You know, are females more likely to be victimized than males? Are LGBTQ youth more likely to be impacted? The answers to both of those questions are yes. Females and children who identify as LGBT or Q are also more likely to be victimized. So it is important for us to have that kind of data. There is other demographic data that I'm not reporting on right now. Hopefully when we get chance in the Q&A, we can give you more information on those different data points. But the fact is that when we have the data at our disposal, it helps us identify more closely and clearly the risks and put in some of those supports and resiliency protective factors ahead of time. What the data does show is that 90% of children who have been trafficked have a previous history of child abuse and neglect, and 50 to 85% have a history with child welfare system prior to their exploitation. So that means even though the child welfare system is supposed to be a protective factor, if you will, a systemic protective factor to take care of youth who have maybe been removed from their home due to abuse and neglect, being placed in foster care or having child welfare involvement actually increases their risk to being trafficked and exploited. So why are child welfare involved youth more vulnerable? And some of these things are things that have been expressed earlier just this morning, but I'll go over some of the ones that are more localized to children who are child welfare involved. Maltreated youth are more susceptible to exploitation. You heard about the impact of trauma on a child's ability to experience resiliency. It impacts their risk factors. Victims often do not immediately seek help, especially if they don't have a trusted adult who they can count on. So children who come to the attention of child welfare are those who have been abused and neglected, and oftentimes the adults in their lives have failed to provide the protection that they need. And so they don't really count on the adults in their lives necessarily being available to them, and they feel that there might be repercussions for saying something to someone, as is in the case of being a witness in a criminal case or a confidentiality safety issue. So they are fearful of reporting things in court, for example, where their perpetrator of their abuse may be present. In a one-year review of 149 local trafficking victims in Alameda County, which is in the Oakland area of California, 55% of the victims were victims who had been living in group homes, and 82% were victims who had run away from their foster home or group home multiple times. That number is quite significant, 82%. We know that traffickers do identify locations where vulnerable youth might be more likely to be living or congregating, and so certainly they are very well aware of where group homes are located in neighborhoods and communities. Group homes in general are not a good placement for most youth and children. We would much prefer that children are raised in family-like settings with caregivers who can provide them that love and attention and support that they need. Another reason why youth who are child welfare involved are more vulnerable is because of their participation in the child welfare system is the monetization of being placed in foster care. Foster parents are paid. Child welfare professionals who come out and visit the children are paid. There are a lot of paid staff who are basically parenting, if you will, the child or youth. And so there is a more vulnerability to see themselves as somebody who has a value placed on them, that their worth is numbered in dollar amounts or access to the kinds of things that they need to survive, like housing or shelter or substances if they have addiction issues, or other things. So it's not unusual for youth to feel that way. And there is difficulty in treating children who have been trafficked. They will require a lot of supports and services, a lot of understanding, and a lot of patience. And for foster parents who maybe don't have appropriate training, who don't know how to support those children, or who don't have ready access in their community to support the children, that can be very vulnerable. So why do we do what we do? With our 93,000 volunteers across the country, we really do have a great opportunity to make a difference. And there are a number of things that we are currently doing, and we look forward to doing more of as we have a greater presence, hopefully, in this area. One is certainly providing more training and education on the topic to our volunteers and the staff that serve those volunteers. We are promoting heavily that the best learning comes from those who have experienced child trafficking or exploitation, so those with lived experience. It's really important for our volunteers and our staff to hear from folks who have those experiences and can talk about those protective factors that made a difference in their lives. It's really important for us to identify and collaborate with the many multiple services and programs that are already available to us so that we can be part of the solution. We certainly don't want to work on our own when we know there's so many great folks working out there in this area. We want to connect with them, learn from them, and work together with them. We want to help our local programs better understand safe harbor laws and what that means, and change their thinking and stereotypes about the kind of children and youth who are trafficked, further, hopefully not further victimizing. We know that our volunteers get to see the children and youth who are vulnerable maybe much more often than anybody else does, and so encouraging them, if they see something or suspect something, that they need to report that to their staff, who can be trained to make the appropriate call-ins to trafficking hotlines and make sure that we are intervening as appropriate. We're really proud of the local programs across the country that are doing work in this effort, and I'm not going to go into detail in any of them because I know I'm running out of time, but these are some of them, and we will post more information for you about them. So we know that having a volunteer can result in positive outcomes for children and youth, including more stable placement, more ability to succeed educationally, less likelihood that they will re-enter foster care, and all kinds of different areas that every day make a big difference in a child's life. And we believe with more training, more collaboration, more education, our volunteers can contribute to reducing the number of children who are victimized and to reduce the number of children who are experiencing repercussions from their horrible experience. Thank you so much for your time. I'm going to pass it over now to Jenna.
Thank you, Debbie. And thank you, everyone who has joined the call today. I am really happy to be able to share some resources and prevention tools that NITAC has built with you all. So NITAC is the acronym for the National Human Trafficking Training and Technical Assistance Center. It is such a mouthful. I stumble on it when I'm talking about it, so we use NITAC. And as our title says, we provide training and technical assistance to help the field prevent human trafficking from happening and reduce the trafficking that is currently happening. So when you're thinking about community engagement efforts with trafficking, it's really important to do so through the lens of a public health and approach and prevention framework. So in the past, human trafficking has really typically been viewed, and still is currently viewed, through a criminal justice point of view, which has really influenced our response to it. And this is really looking at how we can assess survivors in accessing what they need while they are moving through the criminal justice system. So it's a little bit more, the time that we're working with those individuals is a bit shorter. And so this perspective is incredibly important. And now, as the field is starting to mature, we are realizing that human trafficking is also a public health issue that affects individuals, families, and communities across generations. And so in order to work to prevent it, we should be looking or using tactics that the public health field in general uses towards any kind of issues. And so one of the primary benefits of looking at human trafficking as a public health issue is that emphasis on prevention. So when you're thinking about prevention and a public health approach, it really begins by first identifying a problem. So in this case, we know what the problem is already. It's human trafficking. The second step is to ask what's causing human trafficking and to identify some of those risk factors that make certain populations more vulnerable to it. So we just heard Aubrey give us what all of those wonderful, or what those risk factors are and what all of those wonderful protective factors are that we can use moving forward. As Audrey already said, there's many social and economic determinants of health that lead to human trafficking. So awareness of those determinants allow us to begin to create interventions aimed at preventing and reducing trafficking. And that final step in the public health approach is to determine how to implement these interventions and really look at their effectiveness. So in thinking about what some of those, that second step is starting to really look at, or that third step that's starting to look at what some of those interventions can potentially be. This is an article by written by some of our consultants that we work with. And what they did was they looked at how trafficking victims intersect with the healthcare industry as a whole. And what they found was that 67.6% of the survivors that they interviewed reported contact with someone within the healthcare system. So the highest number for that was emergency rooms. But then it trickled down into primary care doctors, OBGYN, dentists, and pediatricians. Those were the top ones. But when you're also thinking about within a healthcare, in a larger umbrella, you're focusing in on behavioral health professionals, public health professionals, and social service providers. And so what we decided to do on NITAC is start to look at how we can provide interventions to professionals that are within that field or those fields so that they are able to start to identify trafficker or potential people with lived experience earlier on. And that's really where we get our starting point for our suite of tools that come out of the SOAR framework. And so as we all know, there are 3 different types of prevention. So there's primary prevention that's trying to prevent trafficking from happening in the first place. We have secondary prevention that's trying to identify trafficking that's currently happening and then stop it from continuing. And then tertiary prevention is trying to improve your quality of life and reduce the chance of re-trafficking. And so that's really what the SOAR framework does. There are lots of different types of SOAR offerings that we provide, and in every single one of them, we are training professionals in the fields mentioned before on on what human trafficking is, and then how to identify, screen for, and then respond to human trafficking. And so there are several different foundational principles that we make sure are woven throughout all of our SOAR offerings. We are really looking to make sure that it's inclusive of all forms of human trafficking. So the overall understanding of trafficking in the United States and really around the world is that there's a dominated focus on sex trafficking. And as professionals, we really need to ensure that from the top down and bottom up, we're recognizing and responding to both sex and labor trafficking. So SOAR really emphasizes delivering trauma and survivor-informed services to all patient and clients. All of our SOAR programming is informed by subject matter experts, including those with lived experience in human trafficking. Trafficking is a crime that affects people from all races and cultures who speak a variety of languages, and so as a result, it's really important that your community is prepared to offer services that are culturally and linguistically appropriate, and we go into how that may be done in all of the different SOAR offerings. And then lastly, we want to make sure that people who are at risk of trafficking or who have experienced trafficking will need the help of a multidisciplinary team of professionals. And so as part of that respond piece, we are making sure that all of the responses are working with a team of professionals and not just one individual. And so our SOAR offerings are evidence-based, and there are 3 different types of SOAR offerings, or 3 different phases. And so Tier 1 is our SOAR for individuals, and that is we have offerings that are available online. So as a professional, you're able to go onto our website and take these SOAR online courses that are for free. We offer continuing education credits for those of you who are within one of these professions, and you can do it at your own pace. If you do not need continuing education credits, then you're able to receive a certificate at the end. As I said, these are free and available online. They're anywhere from 30 minutes to an hour currently, and there are 7 different modules that are available that go deep into trafficking within each of these types of professions that you see here, as well as further into trauma-informed care and culturally and linguistically appropriate services. In October, we are launching 2 more. One is for school-based professionals, and one is specific to Native communities. So not only are you able to take those online, but you're also able to request in-person trainings from us as well. Then as we move further into our evidence-based approach to building capacity, we look at working with organizations. And so with this, we're looking at some of the leadership of organizations where they have already their basic understanding of human trafficking, and then we work with them directly, and this is a 1.5-day long training, to help them think about everything that's needed to make sure that their organization as a whole is responding to trafficking effectively. And then the last offering for SOAR for Communities is SOAR for Communities. And what we do there is, again, making sure that that community has a baseline understanding of what human trafficking is and of that SOAR framework. We then go into the communities and invite about 20 different organizations who are working on trafficking currently to help them strengthen their current response, and we leave them with action plans that they actually create so that they are, after we leave their area and their community, then they are working to continue to build that response in their own community. And we do lots of follow-up with them. So our SOAR offerings, these tools that are available to you all for free, really focuses in on the secondary prevention piece. We do have other programs that try to hit on that primary prevention and tertiary prevention that I don't have time to speak with you all today, but if you're interested, my contact information will be made available at the end of this, and I'm more than happy to talk to you about some of those programs that we have available as well. Okay, and with that, I am going to turn it over to Nova. Thank you all.
Thank you. Hello, everyone, and thank you for joining us here today. My name is Nova Morari, and I'm going to be speaking from the young person's perspective on how collaboration between young people and service providers can be possible and can bring some of the more progressive solutions to some of these issues that are being spoken to today. You may have known Youth Collaboratory, formerly as MINI, but our new name better reflects our mission to harness the power of the youth services community to innovate, evaluate, and drive effective strategies that assure the safety and well-being of youth and young adults. As our new name suggests, Youth Collaboratory finds solutions to complex problems by partnering with research, policymakers, and practitioners. Our agency reaches over 12,000 people per year and will engage with about 3,000 people for training, technical assistance, and consultation. Youth Collaboratory also has a membership of over 200 organizations in 47 states that work closely in the field to identify issues that work to advance in the youth services field. As part of Youth Collaboratory's work as OJJDP's training and technical assistance provider for specialized services and mentoring for child and youth victims of sex trafficking and sexual exploitation, Youth Collaboratory works with Wichita State University Center for Combating Human Trafficking together and provides an array of supports to local agencies as well as national awareness and resource tools for the youth services field. So I'm a consultant for Youth Collaboratory, and I participate on their Youth Catalyst team. So the Youth Catalyst team is a group of young leaders ages from 16 to 24 with lived experience from across the nation, and we are paid consultants, and we focus on preventing and ending young person trafficking, abuse, exploitation, and homelessness to increase positive outcomes for young people. Alrighty. So my presence here today is to speak from more of the young person's perspective and point of view. So some of these slides, we're going to be speaking to some of the other points that have been made by my co-presenters. So the realities of trafficking and exploitation. So multiple factors can contribute to trafficking, whether it's homelessness, toxic relationships, unhealthy family dynamics. There is no one way that trafficking looks like. And I think it's also important for us to remember that there isn't a certain aesthetic for what a survivor looks like. So it's very important to not stereotype, like what was said before, because we may end up missing a group of young people that need supportive services. Now, this is a social issue So it affects the communities, like it was said before, and it is very important that we are trying to gear up to have more services that can connect these young people that are being left behind. So the most affected demographic of young people that can experience these issues are of color, their systems involved, undocumented, and have been involved in foster care. And these are the young people who should be at the table in these discussions when we want to see how we can come up with solutions. So here at Youth Collaboratory, it's really important that we come from a youth-informed and a youth-led approach. So that means letting the young people take the driver's seat in their experience. So letting young people be the experts of their own experience cultivates a sense of power and autonomy. So young people want to be the guides of their own stories. Now, it is okay for people in the service provider industry to help the young person frame timelines of certain experiences that may have, but never the actual story, because we want to make sure that we're refraining from tokenization and we're making sure that these young people's stories aren't being capitalized on. Now, youth-informed and youth-led approaches can also contribute to the young person being able to showcase their strengths and their talents and make sure that they're able to advocate in their own communities. And this also increases in the young person's chances of financial stability. Now, with this youth-informed and youth-led approach, this can benefit organizations because you are getting the needs of your population from that population's mouth. So you have more of a, more of a direct idea of what is needed on the ground and how to meet these needs because it is coming from the young person. Now, this can also increase young people's interest in services. So when we are given a seat at the table and we're given the chance to make decisions on what we want to see in our space that we're accessing services, this can give us more sense of responsibility for what is going on in our space. Lived experience expertise. So with lived experience, for us, it is very important that we feel like we are having decision-making power in our lives. Give me a second. My computer is not wanting to cooperate. Okay. Okay, there we go. As I was saying, so we like to believe that we have some type of sense of power in our lives. And that goes hand in hand with adultism and making our relationships equal, making sure that there is an equal playing field for young people to be able to advocate for themselves and speak for themselves because we know the best, because we are the guides of our own stories, and we know the best because we are the ones on the ground accessing these services and being involved in these systems. Engaging with young people. So when engaging with young people, I think it's really important that in these service providers areas and in these programs, we are hiring culturally diverse and culturally competent staff. Now, when it comes to making sure staff are culturally respectable and aware, we want to be holding staff accountable and making sure that mission statements are reflecting what is being offered in the spaces. So that means making sure that young people's pronouns may be respected, if the person is queer, and making sure that everyone in that space is being treated equally. Now I kind of want to go back to a slide that speaks on meeting some basic needs first. So I think it's really important for us to realize when dealing with young people that we need our basic needs met first, which may be housing and or mental health services. It's really, really hard for a young person who wants to be successful to be worried about going to school and or employment if we are not housed first and our mental health is not being taken care of. So I know that from experience, that can be very traumatic to be asked to tell your story over and over, and then expect to be able to go to work or go to school if you're not stable. Some of the ways that you can engage with young people also look like creating young person boards that are led by young people. So allowing there to be like a body of young people who make decisions for the space. Creating paid opportunities. So things like peer navigators, maybe outreach workers, peer mentors and advisory positions, allowing young people to do the things that I'm doing now, which is speak on, webinars, be able to participate in training. So we're training people who are of the higher managerial positions to be able to know how we want to be dealt with and what makes us feel safe. And I know I'm running out of time, so I'm going to just wrap that up and say that here at Youth Collaboratory, we want to share our resource, which is the toolkit, and it's called Shine. It shines the light on commercial sexual exploitation of children. So this was developed by Youth Collaboratory and the Center Combating Human Trafficking. And there are dozens of modules focused on CSEC and mentoring. So feel free to check out our site, which is on youthcollaboratory.com. And it is also in the handout section pod if you want to go ahead and look into that. And that's all that I have for you all. Thank you so much for your time.
Cynthia Pappas, I would like to thank all of our expert panelists. There was such a fabulous discussion and conversation, and we truly appreciate the bits of information that you gave us. We know each of you could have spoke the entire day, and we would have taken away so much more. But in this amount of time that we have left, definitely want to use it to address some of the questions that we have received from the audience. And thank you, audience, for putting out these really thoughtful, smart questions that we're going to dig right into. I'm going to start with one of the first questions. Is there any money available for trafficking victims authorized through the Act in reference to the TVPA? So as I mentioned, our sister agency, the Office for Victims of Crime, one of the 6 components within the Office of Justice Programs, administers the Crime Victims Fund. I'm going to put a link in for this information as well, which was established by the Victims of Crime Act of 1984. And this fund is financed by fines. It's not tax dollars, so it's fines and penalties paid by convicted federal offenders. And as of 2018, the fund's balance is over $12 billion and includes deposits for federal criminal fines, forfeited bail bonds, penalties, special assessments collected by the U.S. Attorney's offices, federal courts, and the Federal Bureau of Prisons. And I'm going to put the link down here in the chat so you can find more information about how those funds are used and more information about our sister agency, OVC, who does the administration of those funds. And then also under the TVPA of 2000, OVC receives specially designated government funds and independent appropriations from the fund to support victim service organizations to provide trauma-informed, culturally appropriate services for survivors of human trafficking. And I'm going to add their link as well in the chat. So unless my colleagues here want to add anything else about specific money available, we will move on to the next question. Okay, and hearing nothing, Aubrey, where did you get your information on risk protection factors?
Absolutely, and we have some links to drop in there for you as well. But those original pieces came from the Centers for Disease Control and Prevention, and they had information linked to intimate partner violence. And so we kind of took that framework, and the links are available for you. And then we had subject matter experts that came in that were working specifically with trafficking, and just helped give us some additional definition and construct that's more specific for just human trafficking.
Excellent, thank you. And we I just added that link there as well. I'm hoping that is working. Another question. Who's this to Dr. Staub? Has continuous traumatic stress as opposed to post-traumatic stress been looked at as a risk factor for many things, including vulnerability to human trafficking? And then within response to that question, one of our other audience members noted that continuous traumatic stress is an additional term to PTSD and CPTSD since the trauma is continuous, especially interpersonal trauma. So then, which led to a couple other conversations. We're going to hopefully knock the several questions out with one response. Can someone explain the difference between complex trauma and PTSD? So Dr. Staub, I'll start with you, and then if any of our other panelists would like to opine on the difference between continuous traumatic stress as opposed to post-traumatic stress.
Yes, thank you for the question. So it is certainly confusing, and language is used, interchangeably often. What we find is post-traumatic stress disorder is something that occurs because of not a time-limited experience, but for example, the way that most people think of PTSD will be related to a violent event happening, being a participant in the war where you're exposed to violence and you see death, or being involved in a natural disaster, an earthquake, or a hurricane, for example. And those are certainly the after effects of those without the proper supports provided to the person who's experienced PTSD can certainly be a lingering type of trauma that lasts for a long time unless it is addressed. And certainly folks who experience PTSD often have triggering events that can remind them of the original trauma that makes them feel like they're experiencing the trauma all over again. Complex trauma is like the definition, a bit more complex. It often is something that's ongoing that doesn't necessarily get addressed. It is sometimes the trauma that is created by the very people that are supposed to be providing those protective factors for a child or a young person or a partner or a spouse. And so it is a compilation of trauma where the person experiencing the trauma will feel heightened levels of fear and anxiety that are not easily placated unless they get also the appropriate the supports that they need. For very young children who are traumatized, it will definitely impact their development. And I'm sure some of the other panelists can talk about, seeing even brain images of brain scans of even little tiny babies who have been impacted by traumatic events, which could include lack of appropriate caregiving and love and attachment with their caregiver, and it will change the brain growth trajectory. So I probably would love other people to chime in, but I'm trying to make it as simple as possible in a complex world.
I think Aubrey as well. And this came up a couple times. Does placement in a secure facility help victims? And then subsequently, is there any data available that supports the theory that placement does not work? And Jenna,
So this is a question that, oh, go ahead, Jenna.
Oh, sorry.
Aubrey, you can start. Go right ahead. So I think this is going to be one of the questions that we could really spend and should spend even a whole other session on. And so one thing I'm going to kind of go back to is OVC has model standards that talks about trauma-informed. And one of the pieces there is trauma-informed approaches place priority on restoring the survivor's feeling of safety, choice, and control. And so I just kind of think that sometimes in human trafficking responses, we want a yes or a no, and we're trying to do things quickly or just trying to put Band-Aids on a very intense situation. And so I would encourage you as my answer to really step back and say, if we're putting someone in a placement, are we really helping to, place a priority on restoring those things? Again, safety, choice, and control. And if not, is there any control and ability to better inform that system to be able to kind of look through that lens? And so there's some places and some cases that I think that it has not been helpful or impactful, but there's some states that have very limited resources or literally no other options. And they have taken great measure to really be thoughtful if a person has to be detained, has to go into detention, how can they support the survivor even in a difficult situation to ensure that, us trying to look at something as a protective side is not aligning with some of their past abuses from a trafficker and can really broadly support the victim even in an sometimes unsupportive system. And so there's not an absolute answer, but I think stepping back and thinking about what is trauma-informed response and how are we really looking at about building resiliency for this person going forward and help that define your response. And I can give one study that was done really well that looked about labor and sex trafficking among homeless youth, and they looked at some of those kids that were intersected with systems and kind of how that was helpful or harmful. So I'll give that as a link here as well. Jenna, anything you want to add to that?
Nope, I think Aubrey said it beautifully.
Great. Well, thank you both. Another question on the term trafficker. How is the term trafficker defined? A person? Is it multiple people? A system? So as a part of the definition that I provided in the beginning, a human trafficker is one who, through the recruitment, transportation, transfer, harboring, or receipt of a person by improper means. So through force, fraud, or coercion, unless they are under the age of 18, for an improper purpose. Including forced labor or sexual exploitation. And this can be of an adult or a child. And the trafficker can be an individual or a group or a family member. NIJ actually released a report just a couple years back on the nexus, and to address the question, is it an individual or can it be multiple? They had a report on the nexus between organized crime and human trafficking that may be of interest to some, that I'll put in there as well. I'm going to move on to recommendations on quick assessment screening tools. Who would like to take that from our panelists?
This is Aubrey. I can start. Go ahead, Jenna. You go first.
Okay. I can talk about some of the screening tools that are available through the Department of Health and Human Services, and then I'm sure Aubrey will talk about ones through OVC. So there are lots of different screening tools that are out there. For the purposes of this webinar, the ones through the Department of Health and Human Services, there are two. There was one that was created by the from ASPE, or the Assistant Secretary of Planning and Evaluation, and that one is not very quick. It does have a lot of questions that are there, but it is looking to identify individuals who may be at risk of trafficking. So it does not need, there does not need to be trafficking happening at the moment. The other one is called the Quick Use Indicators for Trafficking.
And that one just recently came out. It's new. It is very quick. I think it's about 5 questions that are there. And it is being used both by people within the healthcare realm as well as different social service providers. Now, HHS took a step back and realized that the majority of screening tools that are out there are looking to identify youth who may be experiencing trafficking. And so they put out, OTIP along with NITAC put out a tool that is meant to identify adults. And so that is 18 years in age of older. So those of you, so some of you may be interested in that one as well, and I'm happy to add the links to this chat now. Go ahead, Aubrey.
Thanks, Jenna. And outside of those tips and some of those links that Jenna had just shared, we did a webinar in April that really talked about not just specific tools, but really developing a trauma-informed strategy around screening and really building that relationship. Hello, this is Cindy. I think we might have lost you.
Oh, hi, this is Aubrey. Can everyone hear me?
Yes.
I had fantastic information for you all. So I added a link that gives you back to our human trafficking webinar series, and we did one recently on screening processes and strategy. And so outside of the tools that Jenna just mentioned, it's really helpful to think about what is a trauma-informed relational strategy to create. And so that's a link that you can find as one of our webinars in April this year.
Okay, with that, we still have questions in, and I tried to respond to some within the chat that had just some links to share with our audience. But at this point, sadly, I have to turn it back to William. I thank you all for your time, your attention, your talent, and your interest in this work, which is vitally important to protect the children and youth throughout our country and elsewhere. So thank you. William, back to you.
Yes, Cindy, thank you very much. And before we have folks to leave us, I want to open up a quick poll because we do have a lot of information that we tackled today, and wanted to make sure that we had the opportunity to ask you all to provide us some feedback on what topics around human trafficking you would like for us to see in the future. So if you all could, in the next 30 seconds, just type in the answer, if you would, here on the poll that's being displayed. What topics in human trafficking would you like to see covered in the future? And you can type it in the chat as well, but in the mainly in the poll here, if you could just type in the topic, and it looks like with the popularity of this that we will indeed do a follow-up webinar that could possibly focus on any or all of the topics that you all feel is helpful. I'll give you guys about maybe a few more seconds before we get into the remainder of our last few slides, just some housekeeping notes. And thank you all so much for responding. I appreciate it. This has given us great feedback so that we can maybe focus on a part 2 to this very popular, very successful webinar today. All right, everyone. Thank you very much for providing that. I'm going to go ahead and end the poll here. Last thing that I would like to bring to you all attention is just a few housekeeping slides that we have to keep in mind before we adjourn for today. If you all could please note that well, first let me also be sure to thank our moderators. Thank you very much, Cindy, and thank you to our presenters, Aubrey, Debbie, Jenna, and Nova for a great presentation. You may contact INTAC through the website displayed on this slide. You can stay up to date on the latest information by signing up for INTAC's TTA listserv. Also, don't forget to check us out on Facebook at OJJDP TTA. You may contact OJJDP via the help desk by following the contact information on this slide. Do you have a training and technical assistance need? If so, please visit OJJDP's TTA 360 platform to submit a request for help. As a reminder, the webinar recording will be posted on OJJDP's INTAC YouTube channel that we have. The information for the YouTube channel is indeed here on this slide. And you would contact OJJDP TTA Help Desk for the transcript and other supporting materials related to this webinar. Please take a few moments to review this disclaimer. And finally, we do have a survey that we would appreciate all of you to please fill out for us so that we know how to better improve our webinars in the future. Again, thank you all for today. Have a great afternoon. Goodbye.